what it is that you're dealing with and then how you're supposed to deal with it to make it manageable, you're just running out here haywire. I'm hearing the kids scream from the car. And when I look back, I see blue lights on the car, but I see their shadows and them screaming for mommy. I knew I had to make it up to them. I knew I had created a memory that was etched in stone in their brains.
You're going to see a resolution here that's really is taking legs, not only in Rockdale County, but across this country. I want to introduce Commissioner Dr. Doreen Williams and her innovative approach to stepping up initiatives.
This initiative is sponsored by NACO. It's also sponsored by the Council of State Governments Justice Center and the American Psychiatric Foundation. And the idea is to help counties' efforts to reduce the number of adults with mental illness and substance abuse issues and disorders that are in our jails. When I was very first elected, I went to a NACO conference in February. They had a session on the Stepping Up initiative. It was actually the inaugural announcement about it. I heard it and I was immediately intrigued.
For a long period of time, mental illness became a crime, and that is not fair. That is not fair at all. It really isn't. Having worked with Georgia Department of Correction at Metro State Prison, I saw women coming there for like 20 years, for 25 years, that clearly they were mentally ill during the whole time that whatever crime that had been committed.
There's a sequential intercept map that starts with that community input and support that goes all the way through the court system, the jail system, and then re-entry into the community again.
What we hope is going to happen is people will be reached before they come into the criminal justice system. To me, it bridges the gap. So my role right now is to figure out how could we do this differently so they're not in jail coming before me or Judge Mumford or any other judge.
We have had to certainly begin to evolve the way we treat mental health cases, and the Stepping Up initiative has been a fantastic resource for us in that regard. It has been able to provide for people who have been incarcerated, therapeutic housing, regular housing, counseling, medication for people with diagnosed mental health disorders coming out of incarceration here in Rockdale County. And this has been a huge improvement in those people's lives, and also is a huge step toward making sure that we reduce recidivism.
The last thing that we as law enforcement officers want to do is to incarcerate someone that we have identified that could be possibly suffering through some type of mental illness crisis. But it may not be mental illness that they're going through. It could be substance abuse, such as alcohol or drugs. And so when they go to calls, that training has provided them the knowledge to assist them in possibly identifying someone that may be suffering with a mental illness crisis. And the jail is responsible for that care of that individual. And they deserve mental illness treatment, not incarceration treatment.
If nothing changes, nothing changes. The reality of it is that people are dying. And how much longer can we just sit there and watch? Don't watch me die and then tell me that, oh, we're so sorry. Don't just pray for me. Put your hands on me. You understand what I'm saying? I know that we have some components to the Stepping Up initiative that will alter the way people flow through our systems. It will change the direction, the trajectory, and the end result of the way people flow through our system.
Steps that we're working on is a diversion center where law enforcement can take someone who's acting out either because of a drug addiction or just a psychotic episode, where they can take them instead of to jail. Right now they have two places, the emergency room and the jail.
We need the community's help financially to get this program up and running so that we can help those that are out there in the community that are suffering through mental illness.
So this building is phenomenal. It's about 11,000 square feet, and it's actually divided into 3 separate spaces. The first space that we intend to occupy will be the space for our nonprofit Grit and Grace Rockdale Recovery Community Organization. The second space is smaller. It's got about 6 rooms in it, and we plan to put in transitional beds. Not transitional housing, just beds. This was Judge Mumford's request. The third space, which is the space that we really need a lot of medical expertise, architectural expertise. It's going to take a lot of planning and programming, but that third space is going to be our diversion center.
But when you get a chance, you know, and people don't really shut you out because of what you deal with, then that hope, you know, it's like a light bulb shines in you again.